Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is alcohol and aging, facts and myths. Sponsored by Prince George's County Government and the Department of Family Services.
We are talking today about alcohol and aging, and I call it alcohol and aging because there are so many different kind of myths and facts that I hear from people, or rather more on the myths side. So trying to put some of those aside and get to the true nature. To start, I just wanted to do this again. I'm not, this really is just about the facts and the myths. I like my beer or a glass of wine every once in a while. So there's no judgment here, but I do like, and I have a couple of these polls just to kind of get us in the mindset and to think about, well, what is our relationship with alcohol? Is it like kind of what I said, which I'm actually B, I like a casual drink once in a while. Do you use it to unwind in the evening? Do you use it when or do you have alcohol with dinner? Or you just don't drink, end of story, period. In this area, I find that, and even in the US to a certain extent, we have this kind of culture of alcohol that we don't even really think about too much. But, you know, it's funny because the last time I did this talk, it was right before St. Patrick's Day, and conveniently enough, it's right before Memorial Day. So I'm sure everybody's going out to get their barbecue, make sure they have everything for Saturday and Sunday for Memorial Day barbecues. And frequently that's going to include some alcohol. In fact, I'm sure that the commercials have just popped up and they are telling us all about the different types of drinks we can have now if we feel like going out and buying them. This is also an area where people were expected or are expected to entertain with all of the government here, the military here, the embassies. There's just expectation of entertaining, and in that expectation of entertaining is frequently the idea that there has to be alcohol. And we typically kind of place this onto the young adults, but everybody drinks. And I kind of say that because I do have a much younger cousin who got married, and those of us who are the older cousins are like, where's the water? You know, just need some water. So there's a lot. It's just something that's kind of natural. I thought before we really get into this that it would be helpful to review some of the definitions involved when you're talking about alcohol. Certainly alcohol abuse, it's when your drinking is starting to lead to problems. So you probably don't have an addiction. You're probably on the edge of it. Maybe you're missing a meeting here or there. Maybe you're not being as attentive to your personal care. But it's not a problem. You can kind of recover quickly. Whereas alcoholism is when somebody really starts showing the signs of addiction. So they can't learn from that one mistake and say, oh yeah, you know, Monday, Memorial Day, I drank too much, so now July 4th, I'm not drinking. Whereas somebody who is experiencing alcoholism would not even remember what it, and I don't mean literally, I mean, it wouldn't occur to them to rethink how they do things on the next holiday or at the next big family event or a gathering. And again, just to kind of put in, as I'm going through these definitions, to put in a few of the statistics. We usually, again, think that it's young adults, maybe older teenagers who are the problem, and indeed they are frequently. However, There about 16% of older adults are at-risk drinkers, and yet they're only about 13% of the population. And we're going to talk about that in a little bit, but I just kind of wanted to put that on your radar. A couple more. So addiction, we kind of said this, but it's what the body craves. So you can no longer really say no without having to struggle and fight with it. Tolerance is when you need to take in more to have that same effect. So, you know, usually people are looking to feel a little less inhibited, or they want to be inhibited. And now they need to do it with 2 drinks instead of one, or 1 drink instead of 2 drinks. So it takes a lot. I think I was mixing that up a little bit, but you know, it takes more to get to that point. And I was mixing it up because the older adult body is very different than the younger adult body. That's why I said that. Dependence is what you need to avoid detox. So when the body is detoxing from alcohol, there can be a physical interaction that happens. So sometimes that shaking, sometimes the vomiting. So it really needs, if somebody's really dependent upon alcohol, you do need to be working with a doctor to do detox. And alcohol use disorder is a medical condition. Again, the inability to stop or control it despite adverse social or occupational or health consequences. So if somebody who's not retired, maybe somebody who's 55, they're threatened with losing their job. Somebody who is an older adult, maybe a family member is trying to get you to quit and saying, we're going to have to make a move or do something different. They can't. We also, when we're talking about older adults, talk about low risk and high risk. So low risk drinkers are those who really either don't drink at all or only drink very minimal amounts, focusing on the daily standard drink, which I'll get into that in just a moment. The high risk and problem drinkers are those who have more than that recommended amount per day. Now, long-term drinkers. So these are the people who started drinking years ago. So this has been their habit since maybe they started working, since maybe they were in college, maybe even before there was a drinking age limit. And now they're in their 80s and 90s, and that's still how they drink. The example that I like to give is my father-in-law. He has always had a vodka at the end of the day. That's how he unwinds. And even though he hasn't worked for probably 20 some plus years, he still does it every single day. Even when he visits, he lives in the same area as my sister-in-law, and my sister-in-law doesn't drink at all. They don't like it. So he'll come and he'll bring his little screwed on glass and pour himself that to drink when we're visiting. So he's a very long-term drinker. And then there's recent drinkers who started drinking more after the age of 65. And I'm going to go into why we have those definitions in just a moment here. So what are the standard drinking guidelines for those over 65? Is it A, and again, this is just for you to answer in your head, is it 1 per day, not more than 7 per week? Is it B, 2 per day, and not more than 14 per week? Or is it 3 per day, not more than 21 per week and 7 days, or 7 days? It's 1 per day, or 7 in 1 week, not more than 3 in 1 day. And again, if you don't drink don't think that this recommendation means that you should start. It's just for those people who already do drink. And it's really easy, I find, to hit that 3 in a day if you're not paying attention. And I say that because, for example, again, we don't drink every day here. We don't have a glass of wine with dinner. We'll just maybe have a glass of wine on a special occasion or in a casual situation. But one of the things that my husband and I have always kind of tried to do until we had kids was to go out to a really fancy restaurant and treat ourselves on our anniversary. And I got to thinking about it when I first started this talk. And you can hit 3 drinks really fast. I mean, a bottle of wine alone has 6 glasses in it. A regular bottle of wine, that is, not an enlarged bottle and not one of the mini bottles, just a regular bottle. They will, maybe there's a wait for your table. So of course, where do they suggest you go? To the bar. And then when you start your dinner, of course, you're going to want to have a glass of wine. And then maybe they'll encourage you to actually have a bottle or at least a second glass. And then for dessert, well, if you don't want just another glass of something like a port, well, then there's also a Bailey's in your coffee. And if maybe a fancy dinner is not really your thing, which again, I haven't seen that in 8 or 9 years now, maybe it is just that weekend football game, or maybe this barbecue that's coming up. And you start off and you take 1 drink, and then that helpful grandchild comes along with a second drink for you. It can happen a lot faster than you think. And so 3 in 1 day doesn't mean that you get 1 more for the remaining 4 days. If you're having that nice dinner on Sunday and you've had 3 drinks, well, then you have 4 drinks to last you the next 6 days. So you really do need to kind of think about that. So what is a standard drink? Well, a beer is a regular 12-ounce bottle. Again, I would say there are plenty of beers out there that are 16 ounces. And in fact, if you go and you order a pint of beer, that's 16 ounces. So there you've already hit more than 1 drink. For wine, it's only 5 ounces, which really is not that much. I think the coolers are still about in 12-ounce bottles. It's not really something that I participate in, but I think last time I think at my cousin's wedding, they were in 12-ounce bottles. The shots and shooters, so much of that also depends upon who's pouring it, how much is in there. So really the key is to be aware of the timing, and that's even more important for an older adult, as well as kind of what is the situation? Are people just filling up glasses here and there? You don't even have to ask. Do you have to work to get that second one? And how many have you had today? So the first myth that I hear quite a bit from oftentimes children or maybe neighbors. So she only drinks a few drinks a day. There's no harm in that. And again, I'm also debunking a myth by putting in there that maybe the person who we need to be concerned about is not just a he, but it's also a she. That one I think goes across the generations. But the truth of the matter is that as we age, our body is less effective with processing alcohol. So if you saw back at these, oh no, okay, well, that did not work. If you saw back at my drink list here, for most of us women who are out there, this is standard, or not this one, but the one before it, when it talked about 1 drink a day, 7 per week. that's actually kind of normal for um, those of us who are women because we have more fat in our body. As we age, our muscle mass also declines, and it doesn't matter if you're male and it doesn't matter if you're female. So in alcohol, this age is one of these equalizing factors. Although I guess technically the guidelines actually say men should drink what I just said there, you know, one a day for a week or not more than 3 in one day, and women a little bit less. So it's definitely an equalizer. The other thing is that our metabolism slows as we get older, and this situation with the metabolism is also because there's less of the enzyme in the liver that metabolizes alcohol. So our body is really just not able to process it as well. And it's a toxin, so something has to be happening there. We also, as we get older, have a heightened sensitivity to all substances, which means that whole idea that I was talking about earlier with regard to tolerance, well, now you barely have to have any before you feel what you felt before. So when you were younger and you drank and you felt relaxed with that, you know, like my father-in-law, that one glass. Now, as an older adult, he probably starts to feel it after the first sip or two, because that's, you know, it just impacts us a lot faster. The other thing is that alcohol has a big impact with regard to the medications we're taking, and the medications we take also impact how alcohol affects our body. For some medications, it may enhance what's going on, and in other cases, it might start tamping down on what the medication's doing. So I remember I went to an alcohol and aging conference, and a nurse told this story about one of her patients who had sat down to a Thanksgiving dinner. She wasn't a big drinker, but she had a glass of wine. When she stood up, she immediately passed out. It turned out the reason was right before dinner. And again, I talked about timing. It's not just timing about when you're drinking it, but when you're drinking it compared to other things. She had taken her blood pressure medication, and her blood pressure medication was one of these drugs that was supposed to be distributed throughout the day. So there was that coating on the pill so that it would release just the right amount of alcohol with the amount of acid in your system. Well, the alcohol, just the right amount of medication. The alcohol stripped that covering, and so she got the whole 24-hour dose in one sitting, or whatever it was. I don't know if it was actually 24 hours, but it was enough that it knocked her out as soon as she stood up. So we really do need to think about how are we drinking, and when are we drinking compared to these other things. So do you talk to your doctor about alcohol? Do you ask how it interacts with your medications? Do you say these are my over-the-counter drugs, these are my prescriptions, now I would like to have a glass of wine at dinner, how do I distribute them? And I would say that most of us probably don't. It's not really something that we think about that often. And in fact, I have to say this weekend, I have a little Band-Aid on my chin. I bumped my chin this weekend. Had to go to urgent care. I had been walking around all day. I was completely dehydrated because I was playing tourist in another city. And she did ask me was I dehydrated? But then when it just kept bleeding, she was like, did you drink that day? because alcohol is also a blood thinner. She actually was nice enough to call me the next day, which she didn't need to do, and that's when she asked me that question. And I was like, no, no, we've been walking around all day. We just didn't drink any water. So another myth that we have is he's always had that gin and tonic in the evening. Nothing's changed. Again, it can be risky business. For long-term drinkers, the alcohol is going to be impacting our body differently, as I already mentioned. For recent individuals, there may actually be more of a psychological factor as well. What is the reason for the need to now start drinking? It could just be that there's more opportunity. Maybe there's a setting now that it's being offered. For example, I know in some of the assisted livings, they do have their happy hours. Like I said, here, my husband will have a beer every once in a while, so maybe I can find a beer in the refrigerator, but it's probably not one that I like. Well, now I've moved into an assisted living community and they have an open bottle of wine. I know right now, for example, one of the reasons why I don't open a bottle of wine is because I'll never get to that sixth glass before it doesn't taste good anymore. It'll be like months later. So now I'm in an assisted living and they have a fresh glass of wine here and a fresh bottle. Well, sure, might as well. It might, but it also might be that there's a challenging situation that has happened. Some of the risk factors might be retirement. Maybe somebody was ready to retire, but didn't really have a plan as to what am I going to do, or the fact that other people might not be as available as they are. Maybe there was a retirement that was forced as opposed to one that came when they wanted it to, and this might be some restructuring that's going on. It could also be a medical condition, which is also feeding into that physical change. Maybe there's a physical change. Even with retirement, all of these things, there could be with the retirement and the caregiving, which I'll get into in a minute here, and the physical changes, there's also a measure of grief that we go through. We aren't quite the same person that we were yesterday. We have this vision of ourselves as we get older, and sometimes that vision is right on target, and sometimes it's really not. About 60% of us will have to use some sort of assistive device as we get older. Well, in my head, that's not me. Maybe it's my husband, but it's not me. So the fact that it does become me, there is a grief process that might happen there. Again, I already talked about the medications. With regard to caregiving can be a very strong stressor on someone. So if maybe you've even had to stop working in order to take care of a loved one, maybe it's not even the role that you expected. Again, we all have these kind of, speaking of myths, we all have these myths of what retirement's going to look like, or what our 60s and 70s and 80s are going to look like, what our marriage is going to look like. In my mind, and in my husband's mind, because he's 9 years older than I am, he's going to get sick first and he's going to pass away first. And we haven't even really talked about that, but I know that's what we both think. But what if that's not the case? So caregiving can be very stressful and very emotional. And I don't have to tell any of you all of this, but just to kind of speak through give validation to some of that. Again, we talked about the medications. Insomnia. I had a client who said she used alcohol to go to sleep. And sure, alcohol um, can put you to sleep and does put you to sleep, but it's not a good sleep. It's not the sleep that refreshes you. And most people, when they've had enough to drink that they are able to fall asleep, or maybe they just pass out, tend to wake up faster. So then what do? Do you drink more? Do you not drink more? And again, it's more of that low level sleep as opposed to that deep sleep that we really need. And again, loss of significant others, loss of family or close friends. It statistically, with these risk factors, 20% of older adults with depression also have an alcohol disorder. Now, I will say most of the research tends to focus on men, and with regards to alcohol, and women tend to live longer. So those are things that we that's also another risk factor for them, that they're going to be experiencing more of these. So the other really sad one that I hear quite often is, well, you know, at their age, there's so few pleasures left. And again, I know people are kind of referring to that list that I just went to, the negative side of that list that I just went over. But the truth of the matter is they may just be missing out on life then if they're spending their time with alcohol. So what are the effects on life? Well, I feel I do need to address just the potential benefits, because somebody always wants to know about, well, what about the Mediterranean diet? What about the tannins in wine? Because part of the Mediterranean diet can be drinking red wine. My understanding of that, and again, it's good to talk with your doctor, is that by the time you've had enough to drink to get those benefits, all of the negative effects are actually taking over more than the potential benefits. So, you know, yes, a glass of wine every once in a while is great, but there are other potential impacts of alcohol. And again, I don't mean to, I plan to enjoy my glass of wine well into my 90s if I'm granted time in my 90s. But I will also be taking into account that little sign on the back of my prescription bottle that says, don't drink with wine, or don't take with wine and don't drive. Or at least I hope I will. So some of the negative impacts on life with alcohol involved could be dementia. The woman that I spoke about earlier who said she drank to go to sleep, she actually had an alcoholic dementia. When you have dementia and it's caused by alcohol, it's not like what we tend to think of. Remember, dementia is an umbrella term for all the other types of dementia that are out there, such as Alzheimer's and vascular dementia. Alcohol dementia would be one of them. So unlike an Alzheimer's type dementia, alcohol tends to impact our frontal lobe. Not quite like a frontal lobe dementia, but similar. It impacts our executive functioning. So our ability to make a good judgment about what we're doing, as well as our ability to plan things. And again, not that this isn't impacted by other types of dementia, but specifically alcohol tends to impact those things. So my client would often talk about the fact that she wanted to get away, she wanted to get out of the city, and she wanted to go to where she thought some of her friends would take care of her. And I I put friends loosely because they had already said they weren't going to be taking care of her. And she would tell me exactly, she's like, I'm just going to take a train. I'm going to get out of here. And then I'm going to get on the plane. And the funny thing was she had a bus stop right practically outside of her front door. And where I did not want her to do it, part of me also thought to myself, oh my gosh, if you could just get on the bus and get to Union Station and then get up there, I would be so happy because I would know that you really don't have dementia. But she couldn't. I mean, it was right there within touchstone of her. Now she could find her way to the ABC store right across the street, yeah, actually passing the bus stop. So just very sad in that case. Alcohol also can increase your risk of a stroke. And certainly they think within about 3 to 5 drinks, your brain does kind of shrink a bit. So when you're having more than 3 to 5 drinks. So there is a change. And the other piece with the dementia that I didn't know, but I learned about recently is that whole brain blood barrier that we talk about. You know, we don't want anything to cross over that barrier. Well, alcohol can actually do that. And especially in older adults, because that barrier becomes less, becomes thinner, it can cross it a lot faster and easier. Again, we tend to think about alcohol as being that thing that makes us uninhibited, makes us much more the life of the party. If you're a young person, if you're an older person, it really allows us to relax and enjoy ourselves, we say. But we do need to remember that at its heart, alcohol is a depressant. It's not a stimulant, it's a depressant. So no matter how high and relaxed we feel, and I guess high is probably somewhat of the wrong word, but however uninhibited we feel and how much full of life we feel, we are going to come crashing down. And sometimes that crash is a lot worse than we think. There's isolation that's involved. We do kind of have this weird love-hate relationship with alcohol. I talked in the beginning about the culture of alcohol here in the States and how you can just find it all over the place, depending upon when you're looking for it. Or, you know, now it's baseball season, so now we have to have a beer so we can go watch our baseball game. But God forbid you can't hold your liquor. And, you know, goodness knows if you drink too much, then that's really shameful. So we do have this weird kind of love-hate relationship with it. So consequently, if you recognize that you're really more dependent upon alcohol than you think you should be, then you start to isolate yourself. Which again, there's that whole shaming effect. And then it leads to drinking alone. We already learned from the pandemic how big of an issue isolation has been on all of us. The impact on older adults has been extremely big. And I would say there's been an increase, in fact, there has been a documented increase of drinking during the pandemic. So this is just, you know, it just keeps rolling into itself. It does make our health problems worse. Sometimes it makes it worse just because it impairs our motor functioning. So for an older adult who might not have the best balance anyways, this just makes it worse. But it might also worsen some things, like if you already have diabetes, if you have high blood pressure, or again, liver functioning, since alcohol needs to be processed. And again, we already said the enzyme is not as it's lowered as we get older. So that's going to impact the liver functioning. Osteoporosis can be impacted on there, and of course, our memory with dementia, etc. There is potentially an increased risk of cancer. And I think I've already kind of talked a little bit about the effect on family and social life. But if you're isolating yourself, maybe you're not taking care of yourself if you're drinking. So maybe you don't act as appropriately. You could be an angry drunk instead of, alcohol doesn't necessarily make all of us the fun person in the room. For some of us, it makes the angry person in the room. So those are some of the potential negative effects. So those aren't the signs of drinking. Those are just regular aging. And I kind of just alluded to this in one of my last statements. The truth is alcohol abuse can mimic the signs of aging. So right up at the top, it says balance. So everyone ages differently. The impact of drinking can cause a lot of these things, affect all of these things, right? I might not be as well balanced. I might not be as coordinated. That's why, the police have the testing of you. We know that if you're drinking, you may do things like black out or really have no idea what happened. You may have some incontinence issues or maybe some insomnia, and you might start having tremors. But these are also things that might happen to you as you get older. So you can't say that it's not a drinking problem if the person is drinking. You just don't know. Because how I age normally, I might still maintain great balance, but once I start drinking, I don't. We really don't know until we start looking at, well, how much are they drinking? What happens if they stop drinking? Is their balance still the same? And there's a lot of changes that happen within the body. So it could be mimicking. It could be the alcohol that's doing it. As I said earlier, alcohol can really mask or enhance the symptoms. So it's really important to be talking with the doctor about what you're seeing, and especially with that medication as well, because there have been situations where a doctor will think that it's not the alcohol that's causing the memory issues or the insomnia. And so they'll prescribe something, but then the alcohol stops the medication from impacting it. And I'm just giving an example. I don't necessarily know that these are real examples, but I do know that there are medications that it tamps the alcohol, tamps down the impact of that drug, and therefore the doctors have sometimes prescribed a higher dosage, thinking like, well, it didn't work. Let me see if a higher dosage works. And it turns out, no, it's actually the alcohol that's doing it. So it is really important to talk through that piece with your doctor and to try things without alcohol. So some signs or signals that you might have an issue or somebody you care about might have an issue with alcohol. Those blackouts, memory and concentration trouble. So some estimates say that even 5 to 10% of dementia is caused by alcohol abuse, which is just way too much, I think. Again, that loss of mobility, maybe having bruises because people have fallen or bumped into things. And older adults do tend to bruise really easily. Troubles with the activities of daily living or the instrumental activities of daily living. So maybe not, again, taking care of personal hygiene as much as they used to, not being able to plan out the meals and cook for themselves, or not being able to figure out, whether it's a checkbook or something else. And again, you have to ask when you start seeing some of those IADL problems, all of us in the industry tend to think, oh my gosh, is this a cognition issue? But that's another question that we need to be asking is this person drinking alcohol? And is that what's impacting it? A change in eating or sleeping habits, again, because of how alcohol works, maybe this is waking them up. And so then they're eating at a different time, or maybe they're not eating at all. Maybe their sleep has been impacted. Same thing with that lack of interest in normal routines of hobbies, again, because the alcohol is becoming more important to them. And they might even become annoyed if somebody interrupts it. Again, irritability, maybe it's due to a lack of sleep because of the alcohol issue. Maybe the person is sad or depressed. There could be that there's some chronic pain. Maybe they're saying they want to be alone. They aren't attending the normal things that they used to. Again, that isolation piece, kind of backing out. As I said earlier as well, older adults who abuse alcohol or who have issues with alcohol are 3 times as likely to have other mental health issues. So these would include things like depression, anxiety. A lot of people use alcohol to treat depression and anxiety. I would say we're kind of moving out of this generation, but the older generation, the idea of even talking about mental health, and even some of the my dad's generation, my dad was one of the first baby boomers, and in some ways his generation is much more like his parents than even his siblings who came after him. He was the oldest of 10, so they got that whole boomer spectrum. So not treating mental health issues, but instead treating them at home with alcohol, and again, sleep or dementia. I would say that the backbone of the myths is really about the denial. People, again, we have this love-hate relationship, and love is probably a little strong, but if it becomes a problem, we don't want to talk about it. It's just negative. You just can't handle yourself. Maybe it's a lack of education. In fact, I think a lot of it is a lack of education. I don't know many people, except for I always tell all my friends now, who know that the guidelines differ for older adults. And every time I do this talk, everybody wants to see that picture of what is a standard drink and what does that mean. And I can tell you right now, it's very rare that the 12-ounce beer is sold in draft. I mean, they might have it, but it's sort of like in your Starbucks, right? The whole small, it's completely gone. It's disappeared. You can only get, you really have to ask for that because it's only the Grande and the Venti that are on the board of drinks. It's there, but you have to ask for it. Same thing with the beer. The 12 ounce is there, but it's just this little teeny tiny thing, and you don't really want that much. You want a little bit more. I don't think people recognize how the body changes as we get older with regard to the impact of alcohol. And I think we really don't understand alcohol and our medications. And, you know, some of it for myself, I recognized at one point in time, I was taking something, I don't even know what it was, but like an antibiotic, something that was very short term. I didn't even think about it. It wasn't until like after I got home that night that I thought, I bet I'm not supposed to drink with that. But because in my case, I don't take a lot of medication, so it was just different for me. And it was a once a day pill, so I hadn't even thought about it yet. So some of it could be kind of innocent. I could see how that could happen, but I just don't think spend a lot of time talking about medications and the timing of when we should take things. And again, part of it goes back to that love-hate relationship. The doctor asked me if I drink and how much I drink. And I'm, if I just had 3 or 4 drinks that weekend, I'm probably going to be like, well, I don't really drink that much, but this weekend, we don't like to say that. We don't like to tell our doctors that type of thing. Be aware of the signs if there's a problem, and definitely consult a professional about your concerns. You need to have a plan. You definitely need to share your concerns with the person. That often gives you an idea of where they're at as well. But you do need to be respectful about it. Don't do it when they're drinking. Wait until there's a time when they haven't been drinking, and make sure you're being respectful and you're being concerned. If you go in there saying, well, you're putting yourself at risk or you're putting the other people at risk, they're just automatically gonna shut down. You need to be respectful and talk about your concerns. And again, maybe it's an education piece. It's active listening. So using the I statements, I've noticed and I'm worried, instead of you're drinking, you worry me. Just own your own emotions and let them share theirs. Focus on how it's impacting the relationship and how it's impacting the things that they care about, not how, you remember when you hit that post that one day. It's not generally a good idea to throw out the alcohol. I know that I've also had that where people say, well, I'm just going to throw it all out. But that often just kind of cuts off that relationship there. Hazelden has a really good, you can just Google it, how to talk to an older person who has trouble. Recognize that change is hard. People need to want to change before they can actually work on that. Denial comes quite frequently with this. We like to rationalize it. I just gave you some rationalization of why I didn't think I'm on an antibiotic prescription, or even a prescription in general, or even just taking aspirin. I should see on even the back of the bottle. So we rationalize things. We deny things sometimes without even recognizing that's what we're doing. Maybe people are unaware, if there is some memory loss and dementia, they might not be able to hear that and then follow through on it. Again, my client, she would never believe that alcohol was her issue. If somebody's not open to change, it's really about focusing on the person's safety too. So talk with the doctor. You might have to have an intervention. You may have to talk with Adult Protective Services if the situation is that serious. And Adult Protective Services is happy to talk through situations, or even, the social worker at the county services. Think about the legal issues. If this person is spending all this money on alcohol, or there's another liability situation, be aware of that, especially with things like driving. One of the things that we've had to talk about is if they're putting not just themselves at risk, but other people, because when you're driving, it's not just yourself that you have to be concerned about. If somebody's ready for change, again, the focus is still on safety. You need to recognize that there may be a detox situation, and that does need to be done with a doctor or in a treatment center just to make sure the person is okay, especially with an older adult. It's important to make sure that those symptoms are not as bad as they could be. And there is not one treatment that will do that I can say is great for everybody. It's really individualized. It is important to do as much age-specific programs as possible. There are not a lot of inpatient options, but you also need to look at kind of, are they seeing themselves in there? So it's that social aspect. If they're female, then are a lot of people in there female? Because if they're all male, they're just going to turn, that's not going to work. What about diversity? What about LGBTQ situations? So keep that in mind as well. And these are some names of places that can really get you started, just to ask some questions. I also have a list of resources here that can take care of that. And I'm going to leave this up for a minute, but that's the end of the presentation.
Thanks for watching. If you would like to see more videos like this one, don't forget to subscribe.